I kind of wanted to continue efforts giving back to Athens because I've been here so long, it's kind of like another home now. And so I approached Dr. Steyer about it at the beginning of last year, and he told me about the Mercy Clinic, which is something that they had been wanting to start for us because it was the quickest way we were going to be able to start doing outreach with the community.
Every other Wednesday night, a bunch of students get together and our professors volunteer their time as physicians, and we provide health care to local people who would otherwise go without. We thought the golf tournament would be a fun thing for people to do, and it would be worth the cause. So.
It's definitely worked out really well. We raised a lot of money. It's going to go towards a good cause here at Mercy, but yeah, it was a lot of work.
So the organization of the tournament kind of started with an idea that one of the students had, just saying, hey, that would be a great fundraiser, and we kind of jumped in blind. We didn't really know what we were in for, and it was a lot of work, but I do think that it's turned out. We're here, it's happening. So
Mercy's been really nice in letting us use their facilities to help reach out to this patient population. About 32 of the 40 students in our class, though, are interested in working or have been working with us.
I can really tell that the students just enjoy being here, and it's been really great having their medical background also in every position. It helps me because sometimes I have questions I can ask them.
We wanted to be able to raise funds. Specifically, we want to have supplies to run the clinic, but we think that it's possible to do kind of something bigger, like they are down to one functional scale or something, to be able to give like a big ticket item that we wouldn't use up, that the clinic would be able to keep and use.
Well, I know that we've been doing a lot for the clinic. I got to talk to some of the people who work on Thursday night this last week, and I talked to them, joked about how we have about 6 patients and how they can handle about 18 patients in a night, and they actually told me that they noticed the difference that we've been making for them on their patient load.
It's just a calmer clinic because we have less patients scheduled right now than our regular clinics. So for instance, tonight we have only 7 patients on the schedule, whereas a normal clinic night we have anywhere from 14 to 21, or sometimes even more than that if we have a specialty clinic also. So it's less hectic.
Even though the patients that we see at school are trained, and it's still artificial. So here you're getting with a real patient, you get real reactions, there's real feelings involved, and it feels a lot different.
I'm actually, this is my second time at Mercy Clinic today, and I love it here. It's something that we get to do. It's like outside of the class study that we do, this is the real patient interaction, and so this is what we're here for, and it's very meaningful.
Usually you see something here that we're learning about in school or have learned about in the past couple weeks or months, so it's nice to actually see a patient with what you're learning about.
Mercy has kind of a limited number of drugs, not like a regular pharmacy, but they have, they cover all the drugs you need, but it's an opportunity to go back and talk to the students about this drug and how the drug works, and then you can see the lights come on when they realize, oh, that's when we were talking about, this is what happens in the kidney, so this is the drug that works here, and this is the drug that works in the heart.
Whatever we're studying in class, I see those drugs written down, I see those syndromes, those diseases that the patient comes in with, and so I'm sort of able to take the theory part of it and put the practical part together and make a whole story out of that.